welcome to the interview. Today, I'm speaking with Dr. Bonnie Clipper, a nurse futurist, expert in virtual nursing, nationally recognized thought leader, and a global speaker. Bonnie brings decades of executive leadership, operations, and knowledge of technology together to transform the national healthcare ecosystem. As CEO and founder of Innovation Advantage, Dr. Clipper is leading change and was amongst the first to revolutionize how virtual nursing care is practiced and delivered in hospitals. As a Robert Wood Johnson Foundation Executive Nurse Fellow, she's published extensively on innovation in nursing, including the Innovation Handbook, a nurse leader's guide for transforming nursing, the Nurse's Guide to Innovation, and the Innovation Roadmap, a guide for nurse leaders. Bonnie regularly shares her insights on technologies impacting nursing, such as artificial intelligence, virtual reality, ambient computer vision, and robotics through webinars, speaking, and publications. Dr. Clipper is a member of the prestigious American Telemedicine Association Clinical Council and is a strategic advisor for several healthcare tech companies. So welcome, Bonnie.
Thank you. It's always great to talk with you, Judy.
Well, I'm excited about this topic because I feel like you've just got this tremendous passion for it. And I want our membership to understand a little bit more about virtual nursing and how to distinguish it from perhaps other terms that are used synonymously but shouldn't be. So why don't we start, Bonnie, with you just telling us what is virtual nursing?
Absolutely. So virtual nursing has been around for about 10, 12 years. It's actually not a new concept. What's new about virtual nursing is using it on the inpatient side. So during the pandemic, nurses had to get incredibly creative very quickly. So we learned how to utilize a virtual nurse for inpatient care. So typically when we talk about a virtual nurse, it's usually someone that would be showing up on a tablet or on a mobile cart or even on the television screen. It's a nurse. Generally speaking, in acute care, what we see is registered nurses being utilized for this because of the scope of practice that is required. So it's a virtual nurse that pops up through technology and assists the nurse that is providing direct patient care. So they work in tandem to support patient care.
Okay. And so what exactly is that virtual nurse doing alongside the face-to-face nurse that enhances her care?
Yeah, that's a great question. So the direct care nurse is the hands-on nurse, right? We call those the boots on the ground. So they still are providing care to the patient the way they normally would. The virtual nurse can assist with a variety of functions to help them. So if you think about this, generally speaking, there's two care models. One of them is what we would call the ADT model, admission, discharge, and transfer. And think about that almost as though we utilize kind of a call center approach. There would be a room full of registered nurses, and they would literally just be working from a queue that every time an admission came in and popped up, a nurse would grab it and dial up either through the TV or through the tablet or mobile cart and walk through all the questions that we would normally ask a patient on admission. And the virtual nurse would do that. So it helps to offload the administrative burden from the direct care nurse by giving it to the virtual nurse, who is in a better place to be focused and ask those questions and to document. Now, along with that comes the fact that they can do a limited assessment. Just as you and I are looking at each other right now, I can get a little sense of maybe what's going on with you, how you're looking, things of that nature. But I'm not there to lie my stethoscope on you or to touch your skin and check your skin turgor and things like that. So, and a virtual nurse can do a limited assessment. The direct care nurse would do the deeper assessment. So if you think about this care model, the ADT model, you're offloading these high documentation function tasks, admissions and discharges. They can also assist with transfers that might come up and do the paperwork. That's why it kind of has the look and feel of a very clinical call center. The other care model that we can use is literally that of a care partner. And that looks a little bit different. So that says that if Judy and Bonnie were nurses on a med-surg floor, let's say we each have 6 or 7 patients, and maybe there was Nurse Claudia that was on our floor as well, there could be a virtual nurse that said, hey, Judy, Bonnie, Claudia, I'm going to support you today. So I'm going to help you with your discharges. I will be available to do your hourly rounding on the even hours. And if you need me to do a dual nurse verification of your chemo or your PCA or your blood products, I can help you with that. So think about the assistance that you can get literally by communicating with me and getting me to help. It's much easier than trying to look up and down the hallway and pull a nurse away from other patient activities to try to get them to come assist you. And we're also seeing a lot of really great use cases here for helping onboard and orient and mentor new nurses. So there's tremendous potential there. You know, Judy, and I know being a preceptor is extremely difficult. People don't like to precept anymore, but having someone that's available virtually to assist, mentor, or precept new nurses, that's a great use case for virtual nursing.
Well, that's a beautiful segue into the question that I had, and that was, wow, this seems like an opportunity for mentorship and some clinical debriefing or consultation or something for a new nurse who doesn't have senior people available. Because as you know, Bonnie, our workplaces have seen a fair bit of attrition of our mid to late career nurses with all that incredible clinical expertise. So that's not there. So a new graduate going to another new graduate or going to someone who's had 1 year of experience might not cut it, might not be enough. And so where have you implemented this already? And how are they using it? How are those centers using it? And how are they finding it?
Yeah, so there are hospitals all over the country here in the United States that have deployed this. I'm not as familiar with how many in Canada have deployed this. What's interesting, though, is literally every organization is unique and is approaching this to meet their own care needs. So I've not seen 2 of these be the same. There are ways to certainly use it. And you mentioned something that's incredibly important. The ability to be a virtual nurse means that you have to have about 3 or more years of experience. You can't put a new grad in the box to be a virtual nurse. You just haven't had enough time to develop those really keen assessment and critical thinking and problem solving skills. So when I talk to new grads, they don't like that. But what they do like is now they have the ability to phone a friend. They can get an expert clinical nurse to help them out of a jam or help them if they see something they don't know what to do with, just like that. So there is a lot of really good stuff that's coming out of virtual nursing.
That's very exciting. So do the nurses who are on site access this virtual nurse through a mobile, or how does that work?
Yep, great question. It's different everywhere. Some organizations use their in-house phones to call or text. So if you think about it, we have these nurses that are virtual nurses. They're typically working off-site. They're not on the unit. They might be in an office building, maybe in the same city, maybe in the same state, maybe in a different state, maybe working from home. So you have to have a way to communicate with them, typically via text. It can also be a call to say, here's what I need some help with. And you communicate with the virtual nurse to get the help. Every organization that we've seen, that we've been in, they're all different. So some use it for admission, discharge, and transfer. Some use it for admission, discharge, and transfer. And maybe they're going to use a part of it that allows them to do that dual nurse verification or mentor new grads. What is going to determine how effective and how beneficial virtual nursing is literally the technology that you deploy. So there are several ways you can do it. You can do it on a tablet. You can do it on a mobile cart with a monitor. You can do it on your television. You can have every patient room hardwired with cameras, speakers, and microphones, or you can even notch it up and go to ambient computer vision that has AI built into it. Depending on the technology that you use, that will also tell you how much you can do with virtual nursing. So if you can imagine, if I have a tablet and I'm passing it around patient to patient for my admissions and my discharges, that tablet is transactional, it's intermittent. So that doesn't afford me the opportunity to keep eyes on patients at all times to identify a patient that might be deteriorating clinically or may need intervention. If I have a room that's wired with camera, speakers, microphones, or ambient computer vision, that means I have a line of sight into that patient at all times. I can tell if a patient's deteriorating. I can tell if a patient is trying to get out of bed and shouldn't because they might fall. So the technology really is going to determine how much you can leverage virtual nurses.
Yeah, it sounds like it. And are most institutions sort of revamping their units, or are they doing it a room at a time? Or what are people doing that you're finding?
Well, as you might imagine, that there is certainly a cost to the technology. So there is kind of no emerging theme. I'm seeing organizations that are deploying tablets to start, knowing that they're working towards getting all their med surg rooms wired with camera, speakers, and microphones. That takes time, it takes money to be able to do that. However, in the meantime, you can build your virtual nursing model, and maybe you just use the tablet to focus on admissions and discharges.
Okay, so tell me more about the tablet. Like, walk me through what that would look like. The use of the tablet in a particular scenario. Can you walk us through something like that?
Absolutely. So if you imagine that maybe we're on a med surg unit, there might be, 6 or 8 tablets. It's like an iPad. So you would have to plug them in, keep them charged, wipe them in between patients. Someone would have to take them and hand them to the patient. Patient would have to be able-bodied and comfortable enough to be able to use the tablet to communicate with the virtual nurse. So it's a very low cost to entry scenario that allows you to develop a virtual nursing program. And as you increase your technology, you can always increase what the virtual nurses do to, optimize the heck out of the technology.
Okay, so I'm imagining a new grad, and he or she gets a new admission, right? The admission is stable enough that they can engage a virtual nurse. So they would phone someone, or is this a business that you just hire the business? Like, how do pragmatics work?
All great questions. So you can do it 2 ways. When you set up a virtual nursing program, you can make your own. So you would hire the staff or redeploy the staff and create your own virtual nursing program. Or you can outsource the virtual nurses. You can lease the equipment or you can buy the equipment. So there's so many different variables here to kind of put together to create a program. And every organization is a little bit unique around that. So using the example of that med surg unit, if we're in a large hospital and they actually want to make their own model, that essentially means you would need to determine what your goal is. Is your goal to focus on admissions and discharges? Because if so, generally speaking, the biggest beneficiary of virtual nursing are your med surg units, could be a rehab unit, could be a postpartum unit. ED has the ability to use this for the admissions. ED nurses typically don't like to do admissions because it's more of a kind of a med surg thing. So you have to think about, where are you going to deploy this? What's the problem you're trying to solve? So in this situation, if it's admissions or discharges or both, you have to look at your data. What time of day do those happen? What day of the week do those happen? And then it helps you begin to think about, how are you going to isolate that to create a staffing model? How many of these do you plan to offload to virtual nurses? Because at the end of the day, they're humans as well. So it does take time. We know that generally speaking, it takes between 25 and 40 minutes to do an admission or a discharge. That is if you aren't interrupted, because sometimes it could take an entire shift to finish an admission. So about 25 to 40 minutes. What we're seeing is that virtual nurses are able to knock these out in usually around 12 minutes.
Yeah, because they're not being interrupted.
That's right.
Yeah, they have no other responsibility. I just find this fascinating. I particularly feel drawn to the clinical mentorship, the decision-making, clinical judgment, debriefing in a situation with new nurses. I think that a virtual nurse that they had access to on a tablet could be an incredible asset to them and again to the institution, because as you said, I think nurses are getting tired of preceptoring because there's so few of those who can. So they're always
Yeah,
the ones that are asked, right? And they're
that's right.
good. Um, I always, and I'm sure you get this question a lot, but how do you maintain that patient caregiver connection when you're working virtually?
Yeah, it's a frequent question. So I was just on site 2 weeks ago and spent some time in the box watching the virtual nurses, and it's a unique skill. So it's now recognized as its own specialty by the American Med-Surg Association. So it is its own specialty. There's now a certification exam. When you think about it, about 3 years is the minimum amount of nursing experience you should have. And on top of that, there's really a unique set of skills that go into almost what we would call kind of virtual etiquette, right? So if you notice, while you and I right now are on Zoom, you have to be a little bit more pronounced in your gestures and how you nod and what you do. You have to make sure you're articulating clearly, have to make sure you can hear and speak and they can hear and they can speak. So it is a little bit of a unique skill set. When you first dial up a patient, it's like any other patient interaction. So generally speaking, we teach the nurses to use almost aid it, right? To introduce themselves, acknowledge, introduce, make sure the patients know what the interaction about how long it is and thank them for their time. So when you deploy that, it actually can feel very human in the interaction. It doesn't feel as though you're just talking to a screen. I saw some nurses doing some discharges 2 weeks ago, and they're super, super good at this. And you keep getting better and better. So I see them dial up their patients and literally kind of start with, hi, Judy, my name is Bonnie. I'm a virtual nurse. I've been here in this organization for 6 or 7 years. I've been in this role since we started our program 2 years ago. And I'm going to be your virtual nurse today that actually handles your discharge. I want you to make sure if you have any questions along the way, please let me know and we'll stop and address those. I want to make sure that you're comfortable with your discharge documentation so that when you leave here, you'll know exactly what to expect and how you can manage your care. So different organizations develop different scripts and they go through it and they allow patients the opportunity to ask questions. There was a point in time in virtual nursing where there was a kind of a general assumption that older patients, elderly patients, were not going to like virtual nursing because it doesn't have the same sense of feeling personal unless you really go out of your way to make it personal. And one of the really interesting things that emerged is that older patients like virtual nursing, particularly in hospitals that are wired with cameras and speakers and microphones, because they feel like they get their call lights answered faster. And a really interesting takeaway here, they felt as though their discharge happened faster, more thoroughly, and at a time that was more early in the day, which for older people gets them home faster and safer. Because as you know, older patients worry about being in traffic at 3 or 4 in the afternoon. They just want to get home and be there. So it has a really unique way to check a lot of boxes. So if you can train your virtual nurses to be very empathetic, to be very understanding, animated, convey good information, it can actually be a very positive experience.
So this certification that you spoke of, Bonnie, is that something your organization does, Innovation Advantage?
We do not do the certification. What our organization does is we've created the Virtual Nursing Academy. And what the Virtual Nursing Academy does is we actually work with hospitals and health systems that want to launch and deploy their own virtual nursing program. So we don't come on site and do the work. We teach them how to do it. So we've evolved to become a much more budget-friendly, content-rich way for them to learn how to develop their own virtual nursing program and do it themselves. And we're here to hold them hand. We actually have a group session that we do once a month for 6 months, a different topic every month. And we also provide one-on-one coaching with them each month. So if they're working through their virtual care model, we can actually help them answer questions that are very specific and unique to their organization.
So do you find that the virtual nurses are all regional or local, or do you see the potential for, say, a Canadian nurse to be working in an American context, or a US nurse working in a Canadian context as a virtual nurse?
You know, I think that is all going to have to do with kind of licensure and practice. From a virtual nursing perspective, it does not matter where the virtual nurse is located. There are organizations that actually allow their virtual nurses to work from home. And I think that's going to be the future. I think we are just going to have virtual nurses working from home. As we continue to evolve through this model, I believe that we're going to get there. There are some things that have to be ironed out in order for that to happen, right? I think that we have to make sure that we have high security, high privacy, redundant Wi-Fi and data and all those kind of things. If you're a virtual nurse working from home, you don't get to cancel your shift because your Wi-Fi is down, right? People are counting on you. So that means you have to have a backup plan and a plan to the backup plan, right? So I think there are a lot of things that we have yet to figure out, but I absolutely see us getting there. Where I think this is going to get very interesting is that we have the potential to pull nurses back into nursing who have left for either injury reasons or disillusionment, right? Burnout, other reasons. I think we have the ability to pull them back into nursing. And I think that we're going to have to be very mindful about how we also use nurses at the bedside. Because if you can imagine, there could be a point in time that nobody wants to be the nurse at the bedside. Everybody just wants to be the virtual nurse. But unfortunately, our system requires someone to touch the patients and talk to them and look them in the eye to do that work. So I think there's a lot of evolution in our future.
Mm. And do you see anywhere a model where a scope of practice that is perhaps more limited? Let's just in Canada use the example of a licensed practical nurse being assisted by a registered nurse for those situations that require that level of judgment and critical thinking and whatnot. Do you see those sort of partnerships and collaborations in virtual nursing?
I think they're going to evolve. Right now, we're very registered nurse heavy. However, that's a finite resource. So I do think that we're moving quickly in the direction that this will become the standard of care, even if it's just for admissions and discharges. If that's true, that means one of two things. It means we're going to have to change the way we staff at the bedside to free up enough money and resources to have virtual nurses, or that we're going to have to figure out how to not just rely on registered nurses, but potentially are there others that are trained to assist enough in data gathering to populate an admission or a discharge, which then would be reviewed by a registered nurse in a timely fashion. So I think that's where we're probably going to have to go.
Yeah, okay. Got it. Now, just a slight bend in the road, because the first thing that comes to me, Bonnie, is like I think about a social work interview, or I think about a consult like a psych consult or something like that. In limited situations, would this multidisciplinary idea be coming into the virtual care model?
Absolutely. We're already seeing organizations use this for virtual case management, virtual social work, virtual discharge planning. We know that providers use it for coaching, chronic care coaching. We know it's also used for behavioral health services. So, I mean, I think the use cases, quite honestly, they're only limited right now by our licensure and our imagination.
Yeah, I mean, I think I see, as you said, the discharge planning, but health teaching, right? In that, I'm assuming that that's part of the discharge planning is the health teaching that nurses often just simply don't have time for anymore.
And it might not need to be a nurse that does it, right? Is there someone else that is appropriately trained, credentialed, ready to go that could do that teaching? I don't know, but I think, Judy, these are all things that are going to be developing as we kind of iterate this current and future care model.
Wonderful, Bonnie. Well, to sort of wrap it up, for the members that are interested in looking at this further, so for instance, managers or administrators who say, I'd like to talk to somebody about this, where would they go, Bonnie?
There's two places that I would refer them. The first is the virtualnursingacademy.com. That actually explains what we do for the Virtual Nursing Academy and how they can register and be a part of that. The other place they can go on LinkedIn, they can actually go to our company site, Innovation Advantage. We put a ton of free content out there and different tools. And we have a website, innovationadvantage.com, and we put a lot of free tools out there. If people want to pull stuff down and use it, they can feel free.
Oh, that's wonderful. Well, Bonnie, this has been very exciting and enlightening for me because it makes sense to me, but I don't think that we're there yet, particularly here in Canada. And it may be that there's virtual nursing being practiced. Do you know if there are areas in Canada that are utilizing your model?
I am not familiar with organizations in Canada using virtual nursing. That doesn't mean they don't exist. They probably do. I just don't know where they are.
Okay. Well, thanks so much, Bonnie. Do you have any final words before we send you off?
I think that from the perspective of the nurse, particularly newer nurses, this is going to be how they practice. So I think the important part is to build your skill base and to really get good at assessments and critical thinking, because this is the next evolution. This is what they're going to be doing. This is how we're going to be practicing. And it may be combined roles. We may see very soon the time where nurses are spending 2 days on the unit doing direct patient care and 2 days in the box doing virtual care. So I think we're evolving very quickly in that direction.
Oh, wonderful. Well, that's a great send off for us, Bonnie. Thank you so much for your commitment to this work and for being with me today.
It is always a pleasure to be with you, Judy.
Thanks, Bonnie. See you later.
Thank you.